Support for Radio Friends comes from Homestead Senior Care, providing trustworthy, kind-hearted senior home care services in your loved one's home. All caregivers are thoroughly screened, extensively trained, professional, and reliable. Homestead is all about providing the highest quality home care service to fit you and your family's needs. Plus, if you would be interested in becoming a caregiver, they offer great part-time positions. Give them a call at 573-442-4333 or check it out at homestead.com. Good morning and welcome to Radio Friends on Thursday, October the 26th. We're going to talk about trees to start with, and I want to introduce you to Stewart Scott from Cevet Tree Service. Good to have you here,
Thanks,
Stewart.
Paul.
Now, last time you were on, we were talking about diseases in trees in central Missouri, and you came in today and you were telling me about the emerald ash borer, right? It's now moved into central Missouri.
It has, and there are maps. You can find it online, where it is. It started out in southeast Missouri, then I think through the transporting of firewood, it moved to St. Louis and Kansas City, but the latest map I've seen is just down south of Jeff City.
So what happens when the ash borer moves into the area?
It'll start attacking the ash trees, probably the unhealthy trees first. You can save your trees ahead of time, your yard trees, but if you have 100 acres of forest, it's going to be economically unfeasible to treat every tree in the forest.
Right. So what will happen?
It will kill the ash trees.
The adult ash trees?
Yes.
Will it at one point then, when it's worked its way through, the young ash start over again and they will be immune to it?
No, it's something, the ash borer affects the trees mechanically. It actually bores underneath the larva, bore underneath the bark and affect the vascularity in the tree and prevent the transportation of water and nutrients.
Then it's almost like the Dutch elm disease.
Yes, yeah.
Which we have here in central Missouri, but it doesn't affect every elm tree.
It doesn't. There are some that are resistant to it. There is a very, very large elm tree. Every time I go to Centralia, it's on the southeast corner of the square, a block or two away. Huge. It's larger than this table. And it's been going for obviously for years.
Yeah, so is there anything you can do to prevent the
ash borer?
Yeah.
Yes, you can
treat it
ahead of time.
And what about for the elm trees?
Yes, you can treat that ahead of time also. And then the other disease that's affecting Missouri a lot is the oak wilt. Mm-hmm. I've lost 10 or 15 trees in my backyard just recently.
You're just full of good news today. So
we're gonna live in Kansas pretty soon.
I hope not. I hope not. But the thing is, just you keep an eye on your trees, and if you have a problem, but in the forest, there's nothing you can do.
There's really not.
You can't do. Nature has to work its course there.
Start watching. If it comes into your neighborhood, you'll probably see any disease out of way, and then it'll start moving in towards your house, and that's when you need to be aware.
People want more information. How can they get in touch with you?
881-2466 or cevettreecare.com.
Okay, Stewart Scott, thank you so much for coming by.
Paul.
Bearer of
lots of good news.
Yeah, thank you so much. Good luck to you. All right. Now I want to turn to Dr. Megha Garg, who is with the Ellis Fischel Cancer Center, University Hospital. Good to have you here, doctor.
Nice to have.
You wanted to talk today about breast screening for cancer, right?
Yes.
And this is something that you are doing wholeheartedly at Ellis Fischel.
Yes, that's what we primarily do. So at the Ellis Fischel Cancer Center, we do have a breast imaging division, and we do breast cancer screening. So what we want to do is detect breast cancer early enough before it causes any signs or symptoms in a patient. So we want to detect it when it's very small. So reduce the mortality from the breast cancer and reduce the morbidity, meaning if you have more extensive therapy, there is more morbidity, more extensive surgery or more radiation. So if we detect them early enough, options for treatment are much more.
So how early can you detect breast cancer? Way before there are any signs or symptoms.
Way before
right?
there are any signs. So that's the whole purpose of the screening exam. So we do mammograms, and now Yes.
No, can you detect breast cancer even if the woman is not seeing or feeling a lump?
Yes. So patients, the women, when they come to us, they have no signs or symptoms. They don't feel anything. They have no changes in their skin or anything else. We do the screening, and then based on the changes in the screening, we can detect the cancer, and pretty much when they are very small, earlier stage.
Do you ever get any false readings from the screenings?
Yes, they can give false readings, but once the screening is done, then we go through more testing to confirm what we are looking at the screening, is it really cancer or not.
Yeah, and then so you can rule it out.
You can rule it out or you can find it out, yes.
What are you showing as far as the early detection? Ladies living longer. You're finding that
Ladies
a great
living.
deal, right?
That's a great deal. So when the cancer screening programs were introduced, they were before 2000. So we saw an average about 2 to 3% decrease in mortality, which is very significant for the population per year. So we kind of, after the mammography was introduced, it's a little above 20% decrease in mortality from breast cancer.
Now, there has been some dispute about how often or what age a woman should be screened for breast cancer. What are you recommending?
So we recommend, based on the studies that have shown this effect of mammogram, of early enough cancer screening, that there is reduced mortality. That's what we are going after, to catch them early enough. So start at 40. If you are
40 years of age.
40 years of age, if you are average risk for breast cancer, start at 40, maintain your yearly mammograms.
So you should have a mammogram every year?
Every year, because we want to catch them early enough. If we wait longer, so you don't know if there is something happening in the breast. Mm-hmm. And if we wait for 2 years, 3 years, even if the mammogram will detect it after that, it might not be the same benefit if you detected it earlier.
Yeah. Do you find that when women come in, they are, the first time they come in, it's a nerve-wracking, kind of frightening, isn't it?
It's a little bit anxious. When I got mine done first time,
Yeah.
I am reading it every day. I was also a little anxious. It's okay to have anxiety. Talk to the person who is doing your mammogram. It's always good to ask questions. Ask them what we are doing. They are all our techs at the Ellis Fischel. They are trained to answer all these questions, and we know that people who are walking in our door with no symptoms, they will have some kind of anxiety to see. And most of the time when we are done with the exam, that's the typical thing we hear, oh, that was it.
Yeah. So, oh, that was it. That wasn't too bad after all.
That wasn't too bad after all.
Okay. And it could mean the difference between life and death.
It could mean a lot. Yes, exactly. So we have all our moms, aunts, and people, and I see so many follow-ups of the cancers that we detected a long time back. They're doing good. They're doing fine.
If people want more information, they can contact Ellis Fischel Cancer Center.
muhealth.org and Ellis Fischel Cancer Center.
Okay, go to muhealth.org. Thank you, doctor. I appreciate you coming by today and visiting.
Thanks for having me.
All right, and hopefully you've saved somebody's life today just listening or watching. Right?
Hope so.
We're out of time for today. If there's something you'd like to hear or see, drop me an email, pepperp@missouri.edu. Tomorrow, we're going to talk about scams in Central Missouri. Bye-bye.